Hello and welcome to another episode of CBD Journal Club. I'm Dr. Richard Harris, internal medicine physician, lifestyle medicine physician, and advisor to CBD Health Collection, who generously sponsored this video and our CBD Journal Club YouTube channel. So we're back with another CBD study. We try to find one every month, and this is another human study, which we prefer human studies, but if we can't find a good one, we will go to animal studies and mechanistic studies. But the name of this study is Observed Impact of Long-Term Consumption of Oral CBD on Liver Function, Health in Healthy Adults. 14% of people in 2019 used CBD. This went up to actually 33% in 2020. And this is whoever tried or used CBD in the USA. Very high doses of CBD in some studies for children being treated for epilepsy and in some adult studies have showed elevation in liver function tests. These are tests that we use to assess, guess what, liver function. And this is mainly ALT, AST, total bilirubin, alkaline phosphatase. So when you see these things on your complete metabolic panel or your hepatic function panel, these are what we use to measure liver function. Now, with the exception of diarrhea, all the adverse outcomes, including elevated liver function tests, somnolence, which is sleepiness, sedation, happened in these previous trials when CBD could interact with other medications. A trial of normal adults with 1,500 milligrams of CBD per day, not a single person developed abnormal LFTs in this study. However, another phase 1 trial of CBD with a similar dose, 7 out of 17 people had elevated liver function tests, with 5 meeting the criteria for drug liver injury. So what we know is that the treatment doses are much higher than recreational doses. 10 to 20% of the population has elevated LFTs at baseline, and this is rising. What we know overall for a healthy individuals, 2.5% have elevated ALT, AST. For the general population, about 8.9% have elevated ALT, about 4.9% have elevated AST. And keep that in mind. We'll talk about why that's important in a minute. When evaluating liver function tests and liver function, it's always best to use more values. So don't just use a single value. And that's why in this study, they looked at ALT, AST, alkaline phosphatase, and total bilirubin. The study was to determine the prevalence of elevated LFTs in adult people who are self-medicating with CBD. Now, what they did was they found 839 adults who were taking CBD for a minimum of 30 days. They excluded people on several medications that could cause drug interactions and people who had pre-existing liver disease. After 30 days, there were blood draws and they looked at hepatic function. They collected medical history, cannabinoid use history, and medication history. They also looked at other factors that we know are associated with liver function, and that's height, weight, BMI, sex, age. They also looked at the form of CBD and the composition of the CBD. Was it full versus isolate versus broad? They looked at alcohol intake, number of medications, number of medical conditions, over-the-counter treatments, and number of other CBD treatments used. What they did was they had the participants choose their favorite CBD and had it mailed to them. So 839 adults in 43 states completed the blood work. It was 548 females, 291 males. The average age was 45 and a half. Most of the people in the study were using a full spectrum CBD, 55.7%. Isolate was used at 40% and broad spectrum at 3.8%. The average daily dose was 50.3 milligrams of CBD. So a pretty good recreational dose, but they had a plus minus there of about 40. So you could use, and some people were using up to 100, 120 of CBD per day in divided doses. 49.7% used tincture, 22.1% capsule, 13.9% were using edibles, 12.6% nanotechnology, infused CBD, and 1.7% used food additives, so things they get added to their coffee or tea. The number of elevated liver enzymes was found in 9.1% for ALT, 4% for AST, 1.8% for alkaline phosphatase, and total bilirubin was 1.4%. These results were not significantly different than results for the general population. In fact, the total bilirubin and the alkaline phosphatase results were less than the normal healthy population. Remember, that was 2.5%. The prevalence of elevated ALT or AST in this study was 10.2%, which was not different than the general adult population of 9.8%. And then of the 76 individuals with an elevated ALT, 65% were less than 1 times the upper limit of normal, 8% were between 2 and 3 times the upper limit of normal, and 3 individuals were greater than 3 times the upper limit of normal. Usually when we're talking about significant liver issues and liver problems, it's 3 times the upper limit of normal is when we start to get really concerned about liver function. If ALT was greater than 3 times the upper limit of normal, then 100% of these people had AST elevations. If ALT was greater than 2 times the upper limit of normal, 81.8% had AST elevations. And then if ALT was 1% above the upper limit of normal, then only 25% had elevated AST. So you saw that there was a correlation between elevated ALT levels and AST levels. The higher the ALT elevation, the more likely you were to have AST elevation. Total bilirubin and alkaline phosphatase elevations were only seen in individuals who had a between 1 and 2% ALT elevation. And this was very minor. It was only 0.1 milligrams higher than the upper limit of normal for total bilirubin, so which is normally 1.2. So this was a very minor elevation of total bilirubin. Regression modeling showed that BMI and age can predict elevated ALT, so there was correlation there. There was no correlation between daily dose of CBD or length of use and ALT levels. There's no difference between the CBD companies or the CBD composition, meaning no difference between full spectrum, broad spectrum, and isolate. 70% had medical conditions. On average, it was 2.7 conditions. 62.6% were taking prescription drugs on an average of 2.4 drugs. There's no significant difference between medical conditions and ALT levels and medications and ALT levels. 33 individuals had elevated LFTs and they were followed up afterwards. One had an ALT that was greater than 3 times the upper limit of normal, stopped CBD for 4 months, and the levels remained high. You had 2 who had ALT elevations between 2 and 3 times the upper limit of normal on follow-up, and then they were followed up and these normalized. One continued the CBD. One was a heavy drinker and he stopped the CBD. So most likely it was the drinking that caused those levels to normalize. And then 30 people had an ALT between 1 and 2 times the upper limit of normal. None stopped the CBD. And of these, 7 continued to have elevations on follow-up. We'll talk about that in a minute. Only 2.2% of people reported any adverse reaction. That was 33 people. And only 2 of them were classified as possibly being related to CBD. One case of constipation and psychoactive effects, the other atrial fibrillation, which I find interesting because I've never heard of CBD being related to atrial fibrillation. So this was an observational study because at the time CBD was a class 5 drug. So they couldn't do a randomized controlled trial, didn't want to do a randomized controlled trial, even though a randomized controlled trial would be better to compare CBD to placebo. This study found, like others, that ALT is correlated to BMI, to age, and to gender, but they also found that ALT, AST, alkaline phosphatase are correlated as well. So that corroborates data from previous studies. People in this study were taking CBD for medical purposes, making comparisons to the healthy population unrealistic. However, the LFT levels seen here between the CBD are similar to what we saw in general population. And then many times LFTs are actually elevated transiently and return to normal upon repeat evaluation. This is like what happened with those 30 people that had the 1 times the upper limit of normal. And it's most of them, it normalized on repeat evaluation. The few individuals in the study with persistent LFT elevation, the cause was most likely attributable to something else besides the CBD. And the presence of elevated alkaline phosphatase and total bilirubin was lower than the general population. The authors theorized that this may be due to what we see in vitro. So in vitro studies in cell models or laboratory studies or petri dish studies, CBD has been shown to be protective for hepatocytes, cells in the liver. And so it may be that CBD was helping to protect the liver in these people because they had lower alkaline phosphatase and lower levels of total bilirubin. That's going to need to be teased out in further studies. So in conclusion, individuals self-medicating with CBD do not appear to be at an increased risk of elevations in liver function tests. Underlying conditions and the medications taken for the medical conditions that people had in the study were most likely the cause of the abnormalities. Self-medication with CBD at doses consumed in the study, so the average dose was 50, and then the range was up to 100, 120 in some of the types of CBD, were not associated with clinical liver injury or disease. So this is a good study. We would like a randomized controlled study to look at this further, but this points to people who look like this population taking CBD, that CBD use does not appear to cause adverse effects on liver function tests. So this has been another CBD Journal Club. Thank you, CBD Health Collection, for supporting this channel and sponsoring this channel. If you want to use CBD Health Collection, that's the CBD products that we use in our household. Check the link below the video. Y'all have a blessed day, and we'll see you next month.